Okay. Soon as we get this rolling. So, this is our Adolescent Depression Awareness Program. We're going to spend 2 days on this. Okay? And we'll spend a little bit more time on talking about what else comes through next week as well. Okay? What we have done here is we have created something that is from outside resources. Okay? The Adolescent Depression Awareness Program is something that has been around for a very long time. Okay? It's been funded by some of the top minds in psychiatry. It's been funded by families of suicide victims, teenage and adolescent suicide victims. So what this is supposed to do is we're supposed to create an awareness program for you that was created from the experts and the people that have lived it. Okay? So every single year, every health teacher in the district goes through and gets updated on the training program. We get all of this information, all of these things that we're giving to you, and so we're acting as facilitators of information to give to you, to make you aware of what's going on, okay, with depression, especially in adolescents. Okay, again, the pretest is not going to be graded, all right? You didn't need your name on it. Those ID numbers were just they're anonymous, okay? And then we're going to do this again in a few weeks to see what you recall and what you know now after we're done with this program, okay? So, when we're talking about adolescent depression, what do we know now? Well, what we know right now is that this is a common medical illness. As of right now, okay, you might not think it's very common, but as of right now, it's about 5% of teenagers are dealing with this. Okay, so about 5 out of every 100 teenagers are dealing with adolescent depression. What do we look for? Today, you're going to be able to identify and review symptoms on how to diagnose depression. What are we doing? This is what we're doing. We're spending 2 quality classroom days on getting information and understanding about adolescent depression. Okay? There's a ton of research and a ton of money that's being pumped into this program all the time to give you the best and the latest information and the people that can help you out. We're going to define depression, and I do want you to notice the capitalized D. All right? We're going to learn the process of diagnosing a medical illness today. You're all going to become emergency room doctors for today. All right? And then we're going to identify the symptoms of capitalized D, major depression. Okay. So, I'm going to write you're going to tell me, and I'm just going to write this on the board. Give me a list, give me a word that pops into your head when you hear this word depression. What do you think of? What's the first thing that you think of when you hear the word depression?
Self-harm.
Self-harm. Okay. Being sad. Okay. Suicide. Joel? Isolation. Anything else that you think of when you hear the word depression? I think this is a good list, but do you have anything else that comes into mind when you think about the word depression? Rose?
Self-esteem.
Rose first. Stress. Self-esteem. Low self-esteem. That's okay that you're excited to share. Okay, I think this is a really good list. Okay, I think this is a really great list. Clearly, it means a lot of different things, or it could mean a lot of different things. Let's talk about 2 particular definitions of depression. Okay, you see the lowercase, uncapitalized D, depression, right? That is a feeling of sadness. We have all felt sadness before, just like any emotion. We've all felt sadness. We've all been sad before in some way, shape, or form, about something, about someone, right? That's a normal feeling, right? Just like feeling happy, we feel sad at times, okay? A very normal emotion, a normal feeling, okay? Depression, with a capital D, is something that's very, very different. It is a medical illness and has a particular set of symptoms. And what you're going to do is we're going to identify the symptoms today. Okay? Does anyone know what a symptom is? What is a symptom? When we're talking about symptoms of an illness, what does that mean?
Isn't it like a sign of having something?
Absolutely, right? It's a sign that we could potentially have something. When we're talking about an illness, it's a sign that tells us that we could potentially have this particular illness. Or we can have a number of illnesses, or an illness that we're trying to narrow down, right? Symptoms are signs. Exactly, very good. All right. Let's go over what an actual symptom is, or how we get to these symptoms, okay? So today, you are all emergency room doctors, okay? I am your patient, okay? My chief complaint, my main complaint for the reason for visiting you today is I have a cough, okay? I come into the emergency room, I need to see a doctor, I need to talk to them about my cough, and a number of other things, okay? What illnesses do you think someone could, what do you think right off the bat when you hear someone has a cough? You're the doctor, okay? Someone's coming in, their chief complaint, their main complaint is a cough. What illnesses come to your mind right away?
Cold.
The common cold. Okay, what else? When we have a cough, what else could be going on? What other illness could we have? Bronchitis. I don't even know this one. All right. Bronchitis. If there was a no, there's a couple eyes. All right. Yeah, bronchitis. What else? Bronchitis. What else can we have? I have a cough. Think about what else you could have. You ever had a cough before? What illnesses have you had? Number of other illnesses. The flu. Okay. Anything else you can think of? Don't even think of minor. Try to think of major illnesses too. What else? Someone that's coughing, Rose. Pneumonia. Pneumonia. Very good. Okay. Anything else you can think of? I think that's pretty good. Right? I think that's a good list. All right. So, this is what a doctor does. As soon as someone walks in and you hear what's going on with the patient, you're going to think of a number of illnesses that could be wrong with the person. Okay, that's the thought process of a doctor. Okay, what do you think the first step, though, when you meet the patient? What do you think the first thing we're doing when you meet the patient is? What do you think we're doing as a doctor? Right when we walk into that room or walk into that office. More general, though, what we're going to be doing, we're going to be asking what's wrong, asking questions, right? Very good, right? We're going to be asking specific questions with, like, how long have you had the cough, right? What other questions are you going to ask me? Where does it hurt when you cough? Does it just hurt your throat? Does it hurt your chest? Does it hurt anywhere else when you cough, right? What other questions are you going to ask? Joel? You're going to ask some type of family history. Is there a family history of any type of illnesses that is related with a cough, right? Any cancers, any type of things that could be related, right? What else are you going to ask? What other questions? These are good questions, but what other questions do you get? Think about going to a doctor's office and just for a regular checkup. What questions do they ask? Other symptoms, right? Okay. Other symptoms. Well, when I cough, there's some green phlegm that comes up. I've been kind of tired for a little bit. I've lost my appetite. All right. I've been real fatigued. Okay. So these are great questions to ask, right? Great questions to ask. When you get the answers to these, especially like what other symptoms do you have, what other signs you have to tell us more, you can start narrowing things down, right? So after you've asked the questions, okay, so you know a lot of different things. What's the next step? What do you think you're going to do next? As a doctor, what's a doctor going to do next? a general checkup, right? Or what we call that. And something you take in here too. Not just not a test, but an starts with an E. Evaluation or an exam, right? You're going to examine the body. Okay? How do you do that? How do you examine the person? What do you use? What do you do? What are the steps you take to examine the body? Come on, you've been to the doctor before. They do those things for you. Check your heart rate. Okay, what do they use to check your heart? Stethoscope, right? They put that cold metal on your chest, right? They tell you to breathe in, breathe out. They're checking your heart. They're checking for your breathing. Okay? They're looking for any particular or unusual sounds inside the body, right? Especially with the lungs or the heart. When they're doing that, especially if someone comes in with a cough and these other symptoms. Okay, what else are you going to do? How else are you going to examine the body? Not just checking your heart rate or checking your breathing. What else are you going to do? Blood pressure, right? You put the blood pressure cuff on, you squeeze it up, right? They find out what your blood pressure is. Okay, what else are they going to do for examining the body? What else do they do?
Don't they check your eyes?
They check, yeah, they put the light in your eyes, right? They check the eyes. What else do they check with that? The ears, right? And what else do they check? Open up and say ah, right? They check that too, right? They check the ears, the mouth, the eyes, right? They check those as well, okay? All good things. So we examine the body, right? We kind of examine what we can see on the surface right now, all right? Let's say we've done that, we've asked questions, we've examined the body. We're still not quite sure what's going on with this person yet. What do you think the next step we're going to have to take? What do you think the next step we're going to take in finding the diagnosis of this person? Okay, maybe we start, okay, sometimes yes, sometimes if we don't know what they're doing and it's kind of, time is of the essence, we may start a treatment and if it works, then we've diagnosed it, and if it doesn't work, we try something else. Sometimes doctors do that, yes, that is a method. But let's say we still don't have a clear-cut answer, we have a number, our list has not shortened since we've made it in the beginning. We want to shorten it by doing something else. What are we going to do? So what would we consider doing that? We're taking a number of tests, right? Very good, right? Taking your blood could be a test, like maybe we need to get some blood and examine the blood and see what's going on. What other tests would you do for someone who's coughing up something with phlegm and who's been feeling these symptoms? What else do you get? A sample of saliva, right? A throat culture, right? That's what we call that, a throat culture. When someone has a cough, is it just something wrong with their throat? What else could be wrong? Their lungs. How do we find out? Do we just rip a person open and look at their lungs and see if they are okay? X-ray, right? We do tests, right? X-rays. Throat culture, right? That's just getting a sample of the throat where they take that swab and they stick it in the back of your throat, right? It's bad, right? If you've had strep throat, if you had something like that, you've probably had that throat culture. It doesn't feel good, right? It scratches the back of your throat and you almost like gag and cough up, right? Not cool, right? So we've all been through that. Maybe. Maybe you haven't. Maybe you've gotten lucky. Okay? So, here's your x-ray. Okay? Lungs should be black, right? You should be able to see just all blackness of the lungs. Okay? There's the stomach. There's the heart. There's the diaphragm. This little white patchy substance shouldn't be here, right? That should not be there. This is what you found, okay? When you had the stethoscope, you heard a crackling sound in the breathing when I was breathing back forward. So when you did the X-ray, you found this patch right here, okay, in my lungs. Do you know out of the 4 illnesses that we put on the board, when you find something, a white patchy substance in the lungs, what it could be? Could it be the cold? Could it be bronchitis, flu, or do you think it's pneumonia? Jack?
Bronchitis.
Bronchitis, it could probably be bronchitis. It could be potentially be bronchitis. What else do you think it could be? Well, let's rule some things out. Could it be the flu? No. Flu's a virus. We're not going to find the flu virus inside our lungs, right? Could it be a cold? rhinovirus, right? Common cold, not going to find it in our lungs. Okay, what do we think it could be then? Let's say it's not bronchitis. What do we think it could be? Pneumonia, right? So this is what a doctor sees. When a doctor takes x-rays and they see this, guess what? That is pneumonia right there. I found it. There it is. I asked the right questions. I did the right exam, and I took the right test. I found what you found what you were looking for. You saved me, okay? You asked the right questions. You found out I had a cough, I had a fever, a change in appetite or weight, fatigue or loss of energy, coughing up green phlegm, changes in lung sounds when you listen to the stethoscope when you examined me. As soon as you heard that, you heard the changing in lung pattern, right? You're like, you know what? I want to test you for an x-ray. I saw that patchy area on the x-ray. Guess what? You have pneumonia. What can we do now that we've pinpointed the illness? What can we do? Why is it important to be able to find out exactly what's wrong with the person? We can do what? Effective treatment. Right? We can do effective treatment. We don't have to guess. We don't have to do any guesswork. We can give the effective treatment that's necessary. Okay? Make an accurate diagnosis. That was what that called. That's what you would say in your medical terminology. Make an accurate diagnosis. Right? Why do you think I'm spending so much time talking about pneumonia when we're doing a depression lesson?
It's like the symptoms to actually see the depression, or you can just like you can figure out the difference between like both the depression.
Because depression has a number of symptoms that you can narrow down to pinpoint if someone has it. Depression is a medical illness that a doctor can diagnose, that can successfully diagnose or correctly diagnose, and attempt to treat. Here are the symptoms of depression. These are concrete things that are happening to somebody when you ask the question, when you ask the right questions. How are you feeling? Okay. What about your activities? Do you enjoy? What did you like to do, or what do you like to do? Well, I used to like to play sports. Now I kind of not have enough interest in them anymore. Haven't been eating, or I've been eating a lot lately. Haven't been sleeping well, or I've been sleeping too much. I feel like I'm always restless. I can't stop moving, or I feel like I'm in molasses. Right? I can't move at all. I'm very tired all the time. I cannot concentrate. Sometimes I feel guilty or worthless. And I have recurrent thoughts of suicide or death. Okay? These are things when you ask the right questions, you get these answers, you can potentially diagnose someone with depression. Major depression. All right? Uppercase D, depression. So, if I just couldn't concentrate for a little while, do you think that a doctor would diagnose me with depression? No. If I just kind of stopped eating for a little bit, could you diagnose me with depression? No. If I been having trouble I'm having trouble sleeping for a few days, do you think that you would diagnose someone with depression? No. So what do you need to be able to diagnose someone with depression? What does someone need to show or tell to a doctor to actually potentially diagnose them with depression? More than one symptom, right? Consistent. What do we say? All or most, right? A good number. So we would call that a cluster of symptoms, right? A cluster of symptoms, so more than one symptom. And then how long do you think it would have to last? A couple days? A couple weeks? A couple years? How do you think a doctor would be able to diagnose that if it's been going on for a while? How long do you think it would take? What if it's just a couple hours? Think you diagnose me with depression if it just lasts like every second period? I can't concentrate, and I get sad because I have to listen to Mr. Naughton. Right? That doesn't mean you're depressed, does it? So how long do you think it would have to last? How long? Give me a number. Few days, few weeks, few months, few years? Few weeks? Yep. 5 or more symptoms for 2 weeks or longer. Consistently. feeling these things 5 or more for 2 weeks or longer. So when we get a cluster of symptoms, just like we get a cluster of symptoms for pneumonia, all of these things are happening, I can pinpoint that you have pneumonia. Some of these things, 5 of these things are happening for two or more weeks. They're consistent. I can diagnose you with depression. We can make an accurate diagnosis. We can start treating you effectively. So, there it is. Major depression, 5 or more symptoms, 2 weeks or longer. 2 or more weeks. Remember that. 5 or more symptoms, 2 or more weeks. Okay? Can you see how these symptoms can significantly impact you socially? Not wanting to do the things you used to enjoy to do. You used to enjoy doing. Right? Think about the activities that you're doing. Think about the classes that you love. All right? That you don't enjoy doing anymore. Maybe the friends you hang out with, you don't want to hang out with them. Academically, right? If you used to like getting good grades, think about what happens when they don't have motivation or they can't concentrate. Right? That can affect you academically. And then emotionally, the feelings of guilt or worthlessness, the thoughts of suicide or death. Right? See how it can impact all sides of the health triangle? Matt and I are gone for 2 weeks. We're out for 2 weeks of school. We're in the same classes, we have the same group of friends. Okay? Matt was dealing with pneumonia. I was dealing with depression. When we come back to school, who's going to be able to tell their friends, who's going to have an easier time talking to their friends about why they've been out for 2 weeks? Matt with pneumonia or me with depression? Why? Why is it going to be easier for Matt? Or why is it more difficult for me? Why? Maybe someone doesn't understand what depression is, right? Maybe there's that stigma of depression just being feeling sad. Oh, you're just sad and you can't get over it? What's wrong with you? I'm sad a lot too. I get over it all the time. Right? What's wrong with you? You must be weak. You can't handle just being sad. Right? You see how that stigma of depression can sink in? People may not understand what's going on.
I think like one being like more of a mental illness versus a physical illness is like, I don't know, I think people think of it as more like crazy kind of.
Yeah. You see that stigma again? Maybe there's something wrong with them. Maybe they're crazy. Maybe I should stay away from them. Okay? Think about how hard that would be for a person to tell somebody else. I'm dealing with major depression. I'm on medication or I'm seeing therapy. People might think that you're crazy. Right? Major depression is a chronic illness, which means it's treated, but it's usually never cured. Which means you deal with it for the rest of your life. Something like pneumonia, you take some medication, you take some rest, you're 100% better. Right? Matt's back to normal. Everything's fine with him. He can do everything. You know what? I couldn't play sports. I had a bad cough. I didn't want to get anyone sick, so I had to stay out for 2 weeks. Took medicine. Now I'm okay. What do I have to say? Well, I took some medication. I got some therapy. I got some rest. But I have to continue to do that for the rest of my life if I want to be able to treat my illness. You see how people might think that they're crazy? See how people might think that they're weak? But this is a legitimate medical illness that, if not treated, could cause suicide, could cause to harm other people, could cause life to be ruined, regardless of if someone takes their own life or not. So we're trying to break that stigma of major depression. It's out there, it's manageable, it's treatable with a good diagnosis and with good treatment, right? It doesn't, not everything, we don't have a magic pill for it. But we're trying to make you aware and understand that it's okay that people could be potentially feeling this way. That doesn't mean there's something wrong with them that you have to stay away from them. It just means that there's something that needs to be treated, like any medical illness. Okay? So So we defined both depressions, right? Just the feeling of sadness and major depression. You learn the process of diagnosing a medical illness. You all were great doctors. Thank you very much for saving me today. And then you all identified the symptoms of depression, right? Of major depression. Okay? What do you need to do? If you know someone or you're feeling these ways, you need to tell someone about your concerns. Parents, teachers, coaches, advisors, counselors, school nurses. Okay? There's plenty of people here that can help you out. All right? I'm here to help you if you need anything. If you can't talk to me, talk to somebody. Go to the student services. There's a lot of great people there. At the end of this thing, I'll show you all of your counselors, all of the people in student services. I'll show you a picture and their names, so you know. So if you haven't seen them before, you know who they are, especially if you see them walking down the hallways. Okay? Do me a favor. Take your iPads out. Go to Schoology. Go to Weekly Benchmarks. When you finish with this, don't turn it in because there's another page to it that we are working on. Okay? So open up the ADAP assignment and open up the PDF. The first page, okay, it's called homework, but you can get this done right now, and I'll give you a couple minutes when we get to this class tomorrow to work on this too. All right? I want you to read this paragraph, and you can work in your pods, and you can get the answers, from each other and help each other out. But I want you to be able to find 5 symptoms that this 16-year-old sophomore girl, 5 symptoms may be dealing with major depression. Okay? You can highlight it, but I also want you to put it 1, 2, 3, 4, 5. Be specific on what's going on. Okay? When you're finished with this, don't turn it in because there's another page to it. All right? And then also, there's 5 true or false questions that I want you to answer as well. Okay, so I want this first page done. Work on this as much as you can. You have about 7 minutes in class right now. And then if we need to, we'll spend a couple more minutes on it tomorrow. Okay? And then the second page we'll work on tomorrow with our films. All right, so you're working on that right now.